Hello and welcome to Wired Information. In this video we will talk about the 5 most common medical household misconceptions. Be sure to watch till the end to learn how to combat and solve these problems. Feed a cold, starve a fever. This saying is not backed by scientific evidence and there is no reason to stop eating when you have a fever. The saying feed a cold, starve a fever is a common myth that suggests that when you have a cold, you should eat more to help your body recover, but when you have a fever, you should stop eating to allow your body to fight the infection. In fact, it is important to continue eating a healthy diet and staying hydrated when you are sick, regardless of whether you have a cold or a fever. Eating a healthy diet can help to support your immune system and give your body the nutrients it needs to fight off infections. Staying hydrated is also important, as fever, vomiting, and diarrhea can all cause your body to lose fluids. Drinking plenty of fluids can help to prevent dehydration and support your body's recovery. It is also worth noting that fever is a normal and important response of the body to infection. A fever helps to fight off the infection by making the body's internal environment less hospitable to the invading microorganisms. There is no need to try to lower a fever unless it is causing discomfort or reaching a high level, as a fever can be a helpful part of the body's immune response. Cracking your knuckles will give you arthritis. While the noise of knuckle cracking may be annoying to some people, there is no evidence to suggest that it causes arthritis. It is a common misconception that cracking your knuckles will give you arthritis. Knuckle cracking is the act of intentionally bending and straightening the joints in the fingers, which can cause a popping or cracking noise. It is not clear exactly what causes the noise when knuckles are cracked, but it is thought to be caused by the release of gas bubbles in the joint fluid. While some people believe that cracking your knuckles can cause damage to the joints and lead to the development of arthritis, there is no evidence to support this claim. In fact, several studies have found that knuckle cracking is not associated with any negative effects on the joints. It is worth noting, however, that excessive knuckle cracking or any other type of joint manipulation can lead to joint irritation or injury, and it is best to avoid these behaviors if they cause discomfort or pain. Sugar causes hyperactivity in children. Many parents believe that consuming sugary foods or drinks will make their children more hyperactive, but scientific studies have not found a link between sugar and hyperactivity. In a review of 23 studies, researchers found that there was no evidence to support the idea that sugar causes hyperactivity in children. In fact, some studies have even found that sugar has no effect on children's behavior at all. It is possible that the idea that sugar causes hyperactivity in children may have originated from the fact that children often consume sugary foods and drinks at events such as birthday parties, where they are also engaging in stimulating activities. This may lead to the mistaken belief that the sugar is causing the hyperactivity, when in fact it is the excitement of the event itself. It is still important to limit sugary foods and drinks in children's diets, as consuming too much sugar can contribute to the development of health problems such as tooth decay and obesity. However, there is no need to be concerned that sugar will cause hyperactivity in children. Vaccines are dangerous. Vaccines are one of the most effective and safest ways to protect against serious and potentially life-threatening diseases. While minor side effects such as pain or swelling at the injection site may occur, the benefits of vaccination far outweigh the risks. Vaccines work by introducing a small, harmless piece of a virus or bacteria into the body. This triggers the body's immune system to produce antibodies that can fight off the infection if the person is exposed to the disease in the future. Vaccines have been responsible for the eradication of diseases such as smallpox and the near eradication of others such as polio, and have greatly reduced the incidence of many other infectious diseases. While minor side effects such as pain or swelling at the injection site may occur after vaccination, serious side effects are rare. The risks of contracting a serious and potentially life-threatening disease far outweigh the risks of any potential side effects of vaccination. It is important to be fully vaccinated to protect not only yourself, but also those around you who may be more vulnerable to serious illness, such as young children, pregnant women, and people with compromised immune systems. Vaccines are a safe and effective way to protect against serious diseases and help to maintain herd immunity in the population. Antibiotics can cure all types of infections. Antibiotics are only effective against bacterial infections and will not work on viral infections such as the common cold. It is important to use antibiotics responsibly and only when they are prescribed by a healthcare professional to prevent the development of antibiotic resistance. Bacterial infections are caused by the presence of harmful bacteria in the body. These infections can be treated with antibiotics, which kill or inhibit the growth of the bacteria. Viral infections, on the other hand, are caused by the presence of viruses in the body and cannot be treated with antibiotics. It is important to use antibiotics responsibly and only when they are prescribed by a healthcare professional. Overuse and misuse of antibiotics can contribute to the development of antibiotic resistance, which occurs when bacteria become resistant to the antibiotics that are used to treat them. This can make it more difficult to treat bacterial infections and can lead to the spread of antibiotic-resistant bacteria. If you are experiencing symptoms of an infection, it is important to see a healthcare professional for a proper diagnosis and treatment. They will determine whether antibiotics are appropriate in your case and, if so, will prescribe the most appropriate antibiotic based on the type of infection you have. Are you sick of being influenced by common misconceptions? For a limited time, we are offering a special promotion on the Home Doctor, Practical Medicine for Every Household book by Dr. Maybelle Nieves. Home Doctor by Dr. Maybelle Nieves is the perfect solution for common medical misconceptions. It has helped hundreds of people just like you. Act now and take advantage of this special offer. Click the link in the description to reach the website and order now. Thanks for watching.